probably the biggest news that came out of the meeting for acute lymphoblastic leukemia was one of the abstracts presented at the plenary session. It was the very first abstract presented where the French group was able to show that adding the anti-CD20 antibody Rituximab to their sort of standard chemotherapy backbone significantly improved outcomes. That's the first prospective randomized study that's been able to show that for ALL. It's obviously been a mainstay of treating B-cell lymphomas for over a decade. So this affirms what a lot of us felt in the ALL community, that Rituximab likely has some role for the treatment of ALL, and this really was an important study to confirm that assertion. Rituximab being an immunotherapy agent, a lot of other exciting data in the immunotherapy area for ALL. A couple of the more interesting or noteworthy studies, I think, some of the first data from the ongoing phase 2 study of Blinatumomab, the bispecific antibody that was approved last year for pH-negative ALL, but this was a study looking specifically in pH-positive ALL. And again, affirming what a lot of us in the ALL community sort of suspected, it looks like this drug is active and about as similarly active in pH-positive ALL as it is in pH-negative ALL, which will hopefully ultimately lead to a broadened availability of that drug beyond just pH-negative ALL if those studies or those results are confirmed. And then probably the other big area that I certainly would be remiss if I didn't talk about is CAR T cells. Several studies from a few of the big groups that are doing this work, particularly at Memorial Sloan Kettering, University of Pennsylvania, and the National Institutes of Health, showing very impressive early phase data targeting CD19 on the B lymphoblasts using the patient's own gene-modified T cells. Very impressive results, still early, still a lot to tease out in terms of the toxicity, which is not trivial, often very severe. Striking activity. Unfortunately, it looks like most of the studies, somewhere in the neighborhood of 20% of patients don't respond. And I don't think we have a great understanding as to why that is yet, but those groups are doing a lot of very elegant and thoughtful studies to try to tease that out. So some very interesting, very provocative data that hopefully will help shift a lot of our practice in this disease in the months and years to come.